Welcome to the deep dive. Today we're going to tackle a pretty significant animal health issue. It sounds complex, osteomyelitis, but getting the basics is really key.
Absolutely. It's essentially inflammation deep within the bones, often, kicked off by an infection.
And it can cause some serious problems for pets. We've been digging into the details, specifically looking at veterinary osteomyelitis, definition, diagnosis, and treatment.
Yeah, and our mission here, for you the learner, is really to break it down. What is this thing, osteomyelitis? How does it happen? What should you look out for? And how do vets actually treat it?
Right, trying to give a clear overview without getting totally bogged down in the super technical stuff.
Exactly, a solid foundation.
Okay, so let's start right there. Osteomyelitis. What's physically happening inside the bone?
Well, think about bone. It's not just, one solid piece. It's got layers, compartments.
Uh-huh.
And osteomyelitis is inflammation hitting all of it. The hard outer part, the cortical bone,
Yeah.
the inner lining, the endosteum, that outer skin, the periosteum, the marrow cavity inside, even the little blood channels.
Wow, so it really affects the whole structure.
It does. And the main trigger, the number one cause, usually bacteria.
But I think our source mentioned it's not always bacteria.
That's true, yeah.
Yeah.
Bacteria are definitely the most common by far. But sometimes you see fungi involved, or parasites, even viruses occasionally, or foreign bodies getting lodged in there, or sometimes even corrosion from metal implants like plates or screws used in surgery.
Okay, but mostly bacterial.
Mostly bacterial, yes.
So how do these bacteria actually get into the bone to cause all this trouble?
Good question. There are basically three main ways this happens. First, you could have an infection in the soft tissues right next to the bone.
Like a bad skin infection.
Sort of, yeah.
Yeah.
Maybe a really deep wound infection, and it spreads directly into the bone itself. But honestly, that's less common in small animals, dogs and cats.
Okay, so direct spread is one route, but not the main one for pets. What else?
The second way is through the bloodstream. An infection starts somewhere else in the body.
Right.
Bacteria get into the blood, travel around, and then settle down in the bone. We call that hematogenous spread.
Hematogenous, okay.
But what's interesting is where they settle often depends on the animal's age. In young, growing animals, they tend to land in the metaphysis.
Metaphysis. That's near the ends of the long bones, right, where they grow.
Exactly. The blood flow there is a bit slower, more turbulent, these little sinusoidal loops.
Mm-hmm.
It just makes it easier for bacteria to kind of grab hold.
Ah, okay.
Whereas in adult animals, if it spreads via the blood, it's often the vertebrae, the spine, that gets affected.
That age difference is fascinating. Does it change how serious it is or how you treat it?
It can influence the signs we see, definitely.
Mm-hmm.
Like in young animals, hitting those growth areas might affect development. Spinal infections in adults bring neurological problems.
Makes sense.
And our source also mentions fungi can spread this way too. Often starts with inhaling stores, then travels through the blood.
Okay, so nearby tissue spread, bloodstream spread. What's the third path?
The third way, and this is actually the most common route, is direct contamination. Usually after some kind of trauma,
Like a broken bone.
especially an open fracture,
Yeah.
where the bone breaks and is exposed to the outside.
Mm.
Bacteria get right in.
Makes sense.
But it's important to note, just getting bacteria on the bone doesn't automatically mean a raging infection starts.
Oh.
Often you need other factors there too, like maybe poor blood supply to the area because of the injury, or dead tissue hanging around that bacteria loves.
Like fuel for the fire?
Exactly.
Wow.
Or foreign material dirt, splinters, even surgical implants sometimes. Or just a weakened immune response right there at the site. It's often a mix of things.
So that poor blood supply you mentioned, it's not just a result of the infection. It actually helps it get started and makes it harder to fight.
Precisely. Less blood flow means fewer immune cells get delivered to the scene. And, critically, it means antibiotics given systemically, like pills or injections, have a harder time reaching the bacteria in high enough concentrations.
Right, that makes treatment tougher.
Definitely.
And the source brought up biofilms. Sounds like something from science fiction. What's that about?
It does sound a bit sci-fi, but it's a huge challenge. Biofilms are basically, bacteria getting organized. They create this slimy protective layer around themselves.
Like a shield.
Exactly like a shield, made of sugars and proteins. It physically blocks immune cells from getting in, and it makes it really hard for antibiotics to penetrate and kill the bacteria hiding inside.
Wow.
This is a major reason why osteomyelitis can be so stubborn, so chronic, and why it sometimes comes back even after treatment seems to work. They build these little fortresses.
So the bacteria are basically walling themselves off. That's clever, but bad news for treatment.
Very bad news. Researchers are working on ways to break down that biofilm matrix, but it's tough.
And how does the bone itself react to all this infection and inflammation going on?
Well, the infection and the body's response can actually start destroying bone tissue resorption, we call it.
Mm-hmm.
And if there's instability, like a fracture not healing right,
Mm-hmm.
the infection can make the gap bigger, loosen any implants like plates or screws, which in turn makes it even harder for new blood vessels to grow in, which you need for healing. Becomes this vicious cycle.
Yeah, one problem feeding another. Okay, so it's a nasty process. Who tends to get this? Are some animals more at risk?
Well, obviously, it affects the musculoskeletal system. Any injury-damaging bone or nearby tissue is a risk. The source also mentioned maybe a genetic link sometimes. Certain breeds with immune issues or blood disorders might be more susceptible.
Interesting. How common is it overall?
That bloodstream spread, hematogenous, pretty rare, actually.
Yeah.
But osteomyelitis linked to fractures to trauma,
Yeah.
that's seen much more often. The source notes specific bones like the radius and ulna in the front leg, the femur in the back leg, seem commonly affected in fracture cases. And spinal infections, discus spondylitis, and fungal bone infections aren't exactly rare either.
You mentioned fungal infections and geography playing a role?
Absolutely. Big time. Different fungi live in different environments. So like actinomycosis, often linked to migrating grass seeds, usually hits soft tissue but can reach bone.
Right.
Then you have blastomycosis, big in the central and eastern U.S., Great Lakes, Mississippi, Ohio River valleys, parts of Canada too.
Okay.
Coccidioidomycosis, or valley fever, that's southwestern U.S., Mexico, Central and South America. Histoplasmosis, Ohio, Missouri, Mississippi River valleys again.
So knowing where an animal has lived or traveled is really important for diagnosis.
Crucial,
Mm.
especially if you suspect a fungal cause. You know, if you adopt a dog that came from Arizona, even if it now lives in Maine, valley fever has to be on your radar if it shows certain signs.
Got it. And what kind of animals are we usually talking about?
Mostly dogs and cats.
Mm-hmm.
We touched on breeds with an immune problems, maybe being predisposed.
Mm-hmm.
Young growing dogs seem to get those bloodstream infections and long bones more often.
Mm.
And the source also points out male dogs seem slightly more prone to infections after trauma and also to that blastomycosis fungus.
Interesting sex difference there.
Mhm.
So what are the big red flags, the key risk factors owners and vets should watch out for?
Okay, the main risks really boil down to situations where bacteria can get direct access to bone or where the local defenses are down.
Mm.
Open fractures or a big one bone exposed to the environment, severe soft tissue damage nearby, any kind of penetrating wound.
Bite wounds.
Bite wounds, gunshot wounds, yeah.
Yeah.
Even those migrating grass-awns we mentioned can track bacteria deep inside.
Okay.
Orthopedic surgery is another one,
Mhm.
especially with implants. Vets use strict sterile technique, of course, but infection is always a risk. Bone grafts, too.
Right.
And then anything that weakens the animal's overall immune system makes them more vulnerable. Even infections picked up in the hospital, unfortunately.
You talked about different ways infection starts direct versus spread. Are specific causes linked to those routes?
Yeah, definitely. So things like open fractures, trauma, surgery, implants, gunshots, bites, those are usually direct inoculation, bacteria introduced right at the site.
Got it.
Whereas things like really bad gum disease, periodontitis,
Mm.
or sinus infections, rhinitis,
Mm.
middle ear infections, even infected nail beds, those are soft tissue infections that could potentially spread to bone, either directly or through the blood.
Okay. And the culprits themselves, the bacteria and fungi. Who are the usual suspects?
Staphylococcus is a really common one, especially Staph intermedius in dogs. Our source says maybe up to 60% of bacterial cases. Often it's just that one type.
It's just staph.
Often, yeah. But you also see polymicrobial infections quite a bit, multiple bacteria working together.
Like what?
Often gram-negatives like E. coli, Pseudomonas, Proteus, Klebsiella, and anaerobes bacteria that hate oxygen, like Actinomyces, Clostridium, Bacteroides, Fusobacterium.
A real mix sometimes.
Definitely. And for fungi, the common ones are coccidioids, blastomyces, histoplasma, cryptococcus, and aspergillus. Depends a lot on geography, like we said.
This gives a really good picture of the what's and how. Now let's shift to what an owner might actually see. What signs might suggest their pet has osteomyelitis?
Right. This is key for owners.
Yeah.
First off, an infection right after surgery can be tricky to spot initially. It might just look like normal post-op pain,
Yeah.
but it can smolder and become chronic.
Yeah.
And actually, most cases are chronic by the time they're definitively diagnosed.
Okay, so what does that chronic picture look like at home?
Persistent lameness is a big one, just not using the leg properly for weeks or months.
Okay.
You might also see a wound that keeps draining pus. Maybe it scabs over, then opens up again, just never fully heals.
A non-healing wound.
Exactly. And of course, if there's a history of trauma, a fracture, recent surgery, that's a huge clue.
Makes sense.
If the spine's involved, maybe you'd notice hind limb weakness, difficulty getting up. And again, that travel history for fungal possibilities is a vital info for the vet.
Okay. And what might the vet pick up during their physical exam?
It varies. Acute cases, especially that bloodstream type in dogs, might present as a suddenly sick animal fever, lethargy, no appetite.
Systemically ill.
Right. Plus, local signs like swelling over the bone, really painful to touch, obvious lameness,
And chronic cases.
often more localized.
Mm.
The animal might seem fine otherwise, but the vet might find those draining tracks, maybe some scarring, pain when they feel this specific bone, muscle wasting in that limb from not using it, maybe stiffness in the nearby joint.
Okay.
If it's linked to a fracture that isn't healing, the vet might feel movement or instability at the fracture site, maybe hear a grating sound, crepitus, or see the limb looking deformed. Fungal cases might show limb swelling, lameness that waxes and wanes, those intermittent draining tracks again, and spinal cases, pain along the spine, neurological signs like weakness or incoordination.
It sounds like some of those signs could point to other things too, not just osteomyelitis.
Oh, absolutely. That's where differentials come in. Could it be pannistitis in a young dog, bone cancer, a bone cyst, just a fracture healing slowly, other weird infections?
So you need more than just the exam.
Definitely. A full diagnostic workup is crucial.
What does that involve? What tests are usually run?
It's usually a combo approach. Blood work can help, especially in acute cases looking for signs of inflammation, high white blood cell counts. Sometimes, rarely, with Aspergillus fungus, you might see bits of fungus in the urine.
Okay.
Other lab tests, maybe blood cultures if you suspect bacteria in the bloodstream. There's a specific urine test for blastomycosis. And blood tests looking for antibodies against certain fungi can help too.
What about looking at the bone imaging? X-rays must be important.
Oh yeah, x-rays are fundamental. Though interestingly, in very acute early cases, the x-rays might look totally normal. Yeah. Sometimes, if anaerobic bacteria are involved, you might see gas bubbles in the soft tissues near the bone, which is a clue. But it's really the chronic cases where you see the classic x-ray signs.
Like what? What are you looking for?
You look for sequestra, little islands of dead bone that have separated off.
Sequestra, okay.
You often see new bone trying to form around that dead bit that's called an involucrum. You might see areas where bone has been eaten away, lysis. Fracture gaps might look wider. The outer layer, the cortex, might look thin. The whole bone might look less dense. And you check if any implants look loose.
Lots to look for.
Definitely. There's also a technique called a fistulogram. You inject contrast dye into a draining tract and take an x-ray. It can help map out where the tract goes, maybe show a hidden sequestrum or foreign body that doesn't show up well otherwise.
Are other imaging types used? Like
Yeah.
ultrasound?
Yeah, ultrasound can be useful. It's good for finding pockets of fluid like abscesses near the bone, and you can use it to guide a needle if you want to sample that fluid. There's also nuclear scintigraphy, a bone scan. You inject a radioactive tracer that collects in areas of high bone activity, like inflammation. It's very sensitive, good at picking up something going on.
But maybe not specific.
Exactly. It tells you there's increased blood flow and activity, but other things besides infection can cause that. So sensitive, but not perfectly specific for osteomyelitis.
So imaging gives clues, but it sounds like getting a sample from the bone is the key for a definite diagnosis.
You nailed it. That's the crucial step. You need to get tissue or fluid right from the affected bone.
How do you do that?
Usually either with a fine needle aspirate or often a core biopsy using a special needle called a Jamshidi needle.
Jamshidi, okay.
Or sometimes through open surgery if you need a bigger sample or you're already going in to clean things out.
And what do you do with that sample?
Send it to the lab. Critically, for bacterial culture, you need both aerobic and anaerobic cultures. And, just as important, antibiotic sensitivity testing.
To see which drugs will work?
It's exactly.
Yeah.
Tells you which antibiotics are likely to kill the specific bacteria causing the problem in that animal. And sterile technique when collecting the sample is absolutely paramount. You don't want skin bacteria confusing the results.
Right.
If needle samples don't give an answer, or if you need to surgically remove dead tissue anyway, you take biopsies during surgery. Sample any dead-looking tissue, any sequestra, bits of implant if they're removed, any foreign material.
And send that for?
Culture, definitely.
Yeah.
But also for histopathology, looking at the tissue structure under a microscope. That can show inflammation, dead bone, maybe even see the bacteria or fungi directly. You have to specifically ask for fungal stains if you suspect fungus.
Okay.
And for those anaerobic cultures, you need special transport media to keep those oxygen-hating bugs alive on the way to the lab.
Good point.
And our source makes a really important point here. Generally avoid just swabbing pus draining from a skin opening,
Why?
because it's almost always contaminated with surface skin bacteria. The culture results might not reflect what's actually causing the deep bone infection. You need to sample the deep tissue.
Okay. That makes sense. Get the sample from the source.
Exactly. Oh, and sometimes blood cultures if you suspect sepsis, or maybe a urine culture to rule out the urinary tract as the original source of infection.
So once you get those lab results back, what confirms osteomyelitis?
Finding those sequestra, the dead bone fragments, in a tissue sample is pretty much diagnostic. Seeing lots of inflammation and necrosis, dead tissue in the bone sample is also highly suggestive of bacterial infection. And seeing the actual fungal organisms on microscopy often nails the diagnosis for fungal cases.
Okay, great. So we understand what it is, how it happens, who gets it, the signs, and how it's diagnosed. Let's talk treatment. What can be done?
Treatment usually involves a combination approach, often starting with surgery.
What are the goals of that initial surgery?
Several key things. First, clean everything up to debridement, removing dead or obviously infected tissue. Second, establish drainage so pus and fluid can get out. Third, get those crucial samples for culture and pathology.
Right, the diagnostic samples.
Exactly. Fourth, flush the area really well, lavage, to wash out debris and bacteria. And finally, manage any associated wounds until the infection starts to clear.
What if there's a fracture involved?
If it's an infected fracture, stabilizing it surgically is usually essential right from the start.
And after surgery?
Long-term antibiotics are almost always needed, usually given orally once the initial phase is over.
What about care at home? Nursing care?
It depends on the situation, how severe it is, where it is, how much soft tissue damage there is. Keeping draining wounds clean, preventing spread to other pets, that's important.
Activity.
Usually restricted, especially early on. You don't want them to re-injure it or risk breaking weakened bone. If there's a fracture, restriction until it heals. Physical therapy might come in later to regain function.
Diet. Anything special?
Not usually specific restrictions, just good balanced nutrition to support healing.
And client education sounds really important here.
Hugely important. Owners need to understand this can be a long haul. It could be expensive. The infection might come back. More surgery might be needed. Antibiotics for weeks or months.
Setting expectations.
Exactly. Having that honest conversation about the prognosis, the likely outcome, is critical.
The source went into detail on surgery for chronic cases. What's the focus there?
For those stubborn long-term infections, surgery is about getting rid of all the bad stuff, dead tissue, sequestra, and making sure there's good drainage.
What about implants, like fleats and screws if they're involved?
It depends. If the fracture is stable despite the infection, sometimes the implants are left initially while you fight the infection. But the source stresses, ideally, remove them once the fracture is healed.
Why?
To reduce the risk of the infection flaring up again later around the implant. And there's even a very rare risk of cancer developing near implants left in long-term with chronic infection.
Wow, okay. What if the fracture is unstable and infected?
And then the old implants usually have to come out, the site needs cleaning up, and you need new stabilization, maybe a new plate, or sometimes an external fixator frame.
What if there are big gaps in the bone from the infection?
Bone grafting might be needed to help bridge the gap and encourage healing. Sometimes done later, once infection is controlled. For really big defects, there are specialized techniques.
And extreme cases.
In really severe, localized, chronic infections that just won't clear, sometimes amputation of a toe or even the whole limb or removing the whole affected bone section en bloc resection might be the best option for quality of life.
Sounds drastic, but sometimes necessary.
Sometimes. Oh, and using muscle flaps early on to cover exposed bone can be really helpful. Brings in good blood supply, protects the site.
Okay, let's talk medications. Antibiotics are key, you said. How are they chosen and used?
Right. So often you start with a broad-spectrum antibiotic intravenously for the first few days while waiting for those culture results.
Covering your bases initially?
Exactly. Then, once you have the culture and sensitivity results, you choose a specific long-term oral antibiotic that the lab showed should work against those bacteria.
Makes sense.
You also have to consider side effects, how often it needs to be given, can the owner manage that, and cost, because treatment is long.
How long are we talking?
Usually 4 to 8 weeks of antibiotics, sometimes longer. And the rule of thumb is to continue for at least 2 weeks after the x-rays look good and all the clinical signs are gone.
So you treat past the point where things look normal.
You do. You need to be sure. Luckily, many antibiotics get into bone reasonably well.
Are there go-to antibiotics for common bacteria like that staph you mentioned?
Yeah, staph in dogs is often resistant to basic penicillin because it makes this enzyme beta-lactamase.
Right.
So good choices often include things like cloxacillin or amoxicillin combined with clavulanate that blocks the enzyme. Cefazolin is often used IV initially. Clindamycin is another common one.
What about those anaerobic?
Ampicillin, metronidazole, clindamycin can work for anaerobes. For gram-negatives, you might use aminoglycosides or fluoroquinolones like enrofloxacin.
Fluoroquinolones. Any issues there?
Yeah, they're good drugs, can be given orally. But we try to reserve them for tougher gram-negative bugs like Pseudomonas or infections resistant to other oral options, try to prevent more resistance developing.
Smart.
And for really difficult chronic cases, sometimes vets implant antibiotic beads right at the infection site. They slowly release high concentrations of antibiotic locally.
Like a targeted delivery system.
Exactly. And fungal infections, that's a whole different ballgame. Very long treatment, months, with antifungals like itraconazole, and you continue for at least a month after signs resolve. Sometimes lifelong therapy is needed.
Wow. Pain management must be critical too.
Absolutely crucial.
Yeah.
For comfort, quality of life, and encouraging them to use the limb, which helps healing. Usually injectable opioids and/or NSAIDs initially, then maybe oral NSAIDs or other pain meds long-term.
Are there drugs to avoid? Precautions?
Yeah, those fluoroquinolones, again, generally avoid them in young, growing dogs because of potential cartilage damage.
Okay.
Aminoglycosides can be tough on the kidneys, so you need caution with dehydrated animals or those with kidney problems already. Monitor kidney function if you use them.
What if the first antibiotic doesn't work?
Repeat the cultures and sensitivity testing. Maybe the bacteria changed or something else is going on. Need to find a drug that will work.
And follow-up, how do you monitor progress?
Regular checkups are key. Follow-up x-rays are really important, maybe every 2-3 weeks at first, then stretching out to 4-6 weeks to track bone healing. And if you suspect the infection isn't clearing or it's coming back, repeat those bone cultures.
What are the main complications to worry about?
Recurrence is the big one, especially with chronic infections. It can just flare up again. The infection can also just persist at a low level, if not fully cleared, and that rare risk of bone cancer near implants in long-standing infections.
Okay, so finally, what's the overall outlook, the prognosis?
Generally, it's pretty good, actually. Success rates around 90% are reported in dogs. But again, recurrence is possible, especially if it was a chronic case to begin with.
Right.
Acute infections, or bacterial spinal infections, if caught early and treated aggressively with the right antibiotics, can often be cured, especially if there isn't a lot of dead bone or a fracture.
But chronic needs more.
Chronic usually needs that surgery plus the long antibiotics to get resolution. And even then, it can come back weeks, months, even years later. Might need more surgery.
And in the worst cases?
Very severe, long-term cases where the limb just isn't functional anymore and the animal's in pain. Amputation may be the kindest option in the end.
So pulling this all together, osteomyelitis is, well, it's a complex beast. Bone infection, various causes, needs careful diagnosis, often surgery and long-term meds.
That sums it up well. Early, appropriate treatment gives the best shot, but you always have to be mindful of recurrence, especially in those chronic situations.
It really highlights the challenges.
It does. And that brings us to a final thought for you, the learner. We talked about those biofilms, right? Bacteria building shields against antibiotics.
Yeah, the bacterial fortresses.
Exactly.
Yeah.
Given how tough they make treating osteomyelitis, what other strategies, what new approaches beyond just traditional antibiotics might be on the horizon, not just for animals, but for human medicine too? How else might we tackle these incredibly persistent bacterial infections? It's a really active area of research.